Well, good afternoon and welcome to the OSHA ETS Insider Scoop and What This Means for You webinar. My name is Holly Foxworth. I'm a registered nurse here at Axiom Medical and also the webinar host and the marketing manager for content. I'm extremely excited to be able to bring you such a knowledgeable panel of guests here that are truly OSHA experts, and they're going to be able to break down all things ETS that came out this morning and then also pick up your questions on the back end. Before we get started, I do want to give you just a few quick announcements. You'll notice that there is a bit of a blank screen right now that is probably in the middle of your console. It looks like that there may be some technical issues on the side of our webinar provider. But anyways, if those come up, you will see those at a later point. And in addition to that, though, on your console, what you'll see at the very top, on the top right, that should be where you'll see information about entering the question and answer. So if you have questions about the ETS, if you have questions about the workplace, anything like that for our speakers, please type that into the box and then we will pick those up on the back end. Below that, you'll notice that there is actually what we call our resource section. So it's got everything from white papers. I think there's a fast track to OSHA COVID compliance guide. And then in addition to that, on the left-hand side, you'll see a button, and that's where it is that you can request a demo, meet with our team and talk about a demo for Vaccinating and Testing Vault, which are going to be key to be able for organizations to be able to get their employees up and running and get compliant with what these standards are. Oh, look, it looks like we have a few slides. I don't know whether those are working, Jason, or not, but anyways, so at this point, I'm going to go ahead and turn it over to our guests to introduce themselves and tell us a little bit about their background, and then we'll hop into some of the individual components of the ETS. So I'll start with you, Dr. David Michaels.
Well, thank you, Holly. It's great to be with all of you today. As you heard, David Michaels, I'm a professor at the George Washington University School of Public Health in Washington, D.C. My training is in epidemiology, but I'm probably here most importantly because I was the director, the administrator of the Occupational Safety and Health Administration from 2007 to January, from 2009 to January 2017. I was the longest serving director in OSHA's history. Actually, I've just been replaced. My replacement finally was sworn in yesterday. The position was empty for quite a long time. I've also been working with a group called the Health Action Alliance, which is a coalition of business groups like Business Roundtable, communication groups like the Ad Council, and foundations like the CDC Foundation and the Robert Johnson Foundation, with the objective of strengthening vaccine acceptance, advancing health equity, and rebuilding public health. So I'm just really pleased to be able to speak with you today.
Oh, that's fantastic. I'm so glad that you're here. You've been such a wealth of knowledge and really kind of help us to better understand what was coming down the pike. And then also we're tickled to have you today so that you can kind of give us a little bit further explanation in terms of what's included in the guidance here. I tell you what, why don't we go to Chuck Kable next? Chuck, you want to take it?
Sure, Holly. Hi, everybody. Thanks for being here today. My name is Chuck Kable. I am both the head of legal and the head of human resources at Axiom Medical. I've been a lawyer for over 20 years. And I've spent the better part of the past 2 years learning everything I can about OSHA and observing the way things have developed. And I'm very excited and honored to be a part of the group today. Thank you.
Fantastic. All right. And then Dr. Cherry.
Yes, good afternoon, everyone. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. My professional background is I'm board certified in preventive medicine, public health, and occupational environmental medicine. And I've been supporting the military, industrial, and corporate operations for the past 15 years.
Fantastic. All right. So in terms of what we're going to kind of go through today, we'll talk about OSHA's reach, who these standards will pertain to. Then we'll talk a little bit about size of organizations, because that's been a key ticket in terms of deciding how many employees that you have, how that criteria is met, and what would be specific to your organization. We'll talk about obviously the vaccination, testing, record keeping, et cetera. Pick up OSHA enforcement strategy on the back end, and then finally we'll talk about some best practices for getting your program up and running with question and answer. So I tell you what, why don't we start with Dr. Michaels, and we'll just kind of ask if you can kind of go through that, Dr. Michaels, and let us know, speak to what is in there and how that specifically pertains to some of these different employers, their organizations.
Sure. Well, this is a great opportunity because this standard came out this morning. Actually, officially comes out tomorrow, but we were able to read it today. It's 500 pages, though the standard's only about 13 pages. And those key parts, they cover employers with 100 or more total employees nationwide. So if you have, let's say, 10 sites with 10 workers each, you're covered because that's how they're going to count employees. The number of total people you have. If you have part-time workers, or temporary workers, if they're on your payroll now, that gets covered. OSHA is estimating this is going to cover about 263,000 entities, corporations and firms, about 1.8 million establishments or workplaces, and 84 million workers. The key to it, and I'll just summarize it really quickly, we'll be able to get into it more, it gives employers 30 days, starting tomorrow, to develop a vaccination program. And that can be everybody has to get vaccinated, or you have an option of saying that if you're not vaccinated, you can get tested. Workers can be tested. And then if they come in, though, they have to wear a face covering. It's clearly been set up to encourage mandatory vaccination. Every structure sort of says workers and employers are both going to be really encouraged to do that. So you have to have that program in place 30 days from tomorrow, where you're going to keep track of everybody who's vaccinated. But it's 60 days before you would have to start a testing program, which essentially gives you enough time now if people start getting vaccinated tomorrow or next week, and then you've got to wait 4 weeks if you're doing the Pfizer vaccine, and then another 2 weeks before they're fully vaccinated. You've got some time, but it essentially says at 60 days, you've got to set up a program where people are being tested also. There are a bunch more things in there, and I'm happy to talk about them. Let me stop there, and we can begin to talk about things like that.
Yeah, that sounds great. Okay, so let's talk about then size, because this seems to be a big issue that keeps coming up. I've seen it in some of the questions that we've gotten for follow-ups. We'll pick it up on the back end as well. Chuck, maybe I'll start with you here. So what is that magic number that people are looking at for what the criteria is? How many employees do they have to have for them to fall under this regulation that would be there?
I mean, as Dr. Michaels said, right, it's 100 employees across the country from a payroll perspective. I think it can get a little more nuanced than that. We've been getting a lot of questions about, well, what if, everyone's a 1099, a contractor, or what if I've got two separate subsidiaries? I think you start to get into concerns over what's called the joint employer doctrine at that point. And so you want to be mindful of how you're structured and seek independent legal advice to kind of understand where those issues lie, right? Because it may not be as simple as I have two separate entities under common ownership and there's 10 and then there's 90. We're good. Well, no, you may not be good because that common ownership could trigger what's called this doctrine of joint employer, the joint employer doctrine, which would essentially deem you as being a 100-person company for total size purposes. So the doctrine's been around for a long time. I mean, there was a while where private equity companies had some concern around portfolios and whether they would be implied to have this big organization because of the control aspects. So there's enough information out there for you to get some reasonable advice from outside legal counsel, but don't assume just because you've got a subsidiary structure or contractors that's going to be good enough, right? So what we learned, at least on the healthcare ETS side, was there was some very specific language around, who is counted towards that 100 number. It's less clear in this more broad standard, but I still think that businesses should be wary and mindful of the fact that there are these legal doctrines that could foot-fault them into that 100 or more category.
Mm-hmm. Yeah, definitely. And so there was also, yeah, go ahead.
Can I
Sure.
add to that? OSHA
Sure.
has also asked the question, should this apply to smaller employers? And they've opened up a docket, they're asking for comments, and they could easily come back in a few months and say this should be covered going down to 10 employees, for example.
Yeah.
That's a great point. That's a great point.
Really good point. Yeah. Well, and we've had a lot that have asked that specifically. We even got emails this last week that said, I don't have your employees, but is this something that I should be looking at? And I think it always kind of comes back to that conversation of where we talk about do the right thing, about taking care of your employees, and ultimately that's what keeps your workforce safe. So one thing I did want to ask, though, maybe if one of you could kind of give some clarity on the difference between the OSHA ETS and then those that would fall within the CMS, and then also those federal contractors. Could somebody give some additional information about that?
Well,
Dr. Michael,
I'm happy
if you have
to
it, you're
start.
welcome. Okay.
Well, go ahead.
So, I mean, I'll chime in just a bit, Holly. I think so. The CMS piece, right, is particular to those entities that are receiving payments from Medicaid, Medicare, right? So that's the authority and the control that HHS has over kind of the health system. Is they can condition payments on meeting certain requirements, as those of us with healthcare experience understand. And so they are attaching this concept of vaccinations to essentially the entitlement to receive payments under Medicaid and Medicare, is my understanding. Which is, a little bit different than the kind of this general standard, more particularized to kind of hospitals and healthcare. But again, meaningful, right? Because anything that's going to impact revenue is a big deal.
Yeah, definitely. Yeah. Dr. Michaels, did you have something you wanted to add to that?
This is part of a suite of 4 different federal regulations that President Biden announced in September. The first one was federal workers, and they all have to get vaccinated. The second, federal contractors, and that's if you're on a contract that's been modified or new since the beginning of October. Every employee involved in that contract has to be vaccinated, and it's quite broad in that it includes things like the accountants in the central office who might be working on the contract, or other people in the same facility where you have workers working on the contract. For both of those, which have been in effect for a while, there is no alternative. There's no testing. It says you must be vaccinated, except if there's a special exemption for medical or religious grounds. This new CMS rule that came out today, also, it doesn't provide any sort of testing alternative. Everybody must be vaccinated except if there's an exemption. And so OSHA is the only one that is more complicated. Workers can choose not to be vaccinated. If they do that, then they have to do certain things and the employer has to do certain things.
Okay. And Chuck, I definitely want to come back and revisit that piece about the exemptions, because there's definitely been a lot of discussion about that. But in terms of the workplace vaccination testing, some of this data that's here, what specifically, Jason had mentioned, guys, if you'll refresh your screen, they're saying that the platform may be up so that you can see our slides. So those of you who are viewing from an attendee standpoint, if you'll just refresh that, hopefully they'll get you where you need to be. So back to the vaccination piece about the testing, the real-time data, et cetera. So one of the biggest things that we are getting continuously is who's responsible for paying for this. So if someone doesn't have the vaccine, then who is the one that's responsible for paying for this at a minimum weekly testing?
So vaccinations are free.
Right.
Vaccinations are free, but employers have to, once this goes into effect, which is 30 days from tomorrow, employers will have to give workers time off, 4 hours of time off at least, to be vaccinated. They don't have to pay for the vaccination. In terms of recovery, they have to give workers time off to recover. They can work things out in terms of who covers the sick pay. If workers have sick leave coming, employers can have them take that. But if they don't have sick leave coming, that time has to be paid for again by the employer. Testing, though, does not have to be paid for by the employer. OSHA left that up to the employer. I know that there are many companies with collective bargaining agreements where this will be negotiated. In many cases, in those cases, I suspect the employer will have to pick up the costs. But I think this is written to push some of these costs onto workers because this testing can be expensive, it can be time-consuming, and sort of burdensome. So this will encourage people to get vaccinated. And the testing is not simply you can pick up a test at the drugstore and you can have it done at home. It has to be proctored or observed. In other words, you could have the testing done, the employer can have the testing done in their offices, in their medical clinic, where the physician watches it and sees the result. Or there are systems now where you could be tested home and on your cell phone, someone's watching you do it, those are expensive. And but right now, that's sort of where OSHA is leaving it. They're going to leave it up to the employer to figure that out.
So then with the employer being left to figure that out, then do they still have to fall within what the guidelines would be of whether they need like a PCR test or that it has to be that proctor type of observation if it is done at home?
Well, it could be a PCR or a rapid antigen test. There's actually some possibility for even doing this pool testing. If you're an epidemiologist, that's sort of interesting. But the main thing it says, though, is if you've got a positive test, you've got to also pull someone from the workplace. They have to be isolated. Antigen tests can give you false positives. So if you start with an antigen test, you have to be prepared to follow with a PCR.
Yeah, definitely. Okay. And then is it the responsibility of the employee then to bring back that negative result if they are the ones that are actually getting the test?
Well, it's actually, OSHA looks at it as the employer's responsibility to make sure the employee does that. OSHA has no authority over employees, but says to the employer, you've got to get that information and you've got to figure out how to get it and how to maintain it, because OSHA can ask for that information and you've got to reply pretty quickly when OSHA calls up and says, I want to see your roster of all your workers and when people have been tested, when they've showed you they've been vaccinated, things like that. You've got to be prepared to do that.
Yeah. Wow. So Chuck, then let's kind of get to the exemption piece there, because you had spoken actually at SHRM, I believe, yesterday, whenever about some of these exemptions and things that employers would want to look at whenever they're thinking about it in the big picture and process-wise. So talk to us about those exemptions and some things maybe that there's still a gray area around.
Yeah, well, I mean, it's certainly, OSHA's recognized that there are situations in which vaccination, should not be or cannot be delivered to an individual employee, right? It's contraindicated medically, for example, if there is a medical reason to delay vaccination, and then, of course, whether there is a reasonable accommodation that can be made for someone with a medical condition or a sincerely held religious belief, which is, I specifically spoke about to SHRM yesterday. The lesson for employers on this point is, you have to be prepared to manage that process, right? And the most important thing is to remember uniformity and approach is where you want to be, right? So kind of this concept of a written policy, which is contained in the standard, is important. And you may want to consider the way in which or revisit, I should say, your accommodation policy and approach to make sure you have something to compare against and pressure test when you're attempting to demonstrate consistency in application. The biggest, I think, or the 10,000-pound gorilla really is how everything works out relative to the religious accommodation request, because there have been a flood of these and we expect that to continue. So employers have to be very cognizant of that and make sure that the process and mechanism for obtaining that information from employees is very clear. You have to communicate very well, right? Transparent communication, because ultimately, as I said yesterday with SHRM, this is a big cultural issue too, right? So not everybody is comfortable with being told you must do this. And so they will be seeking potentially ways to not have to, submit to a vaccination mandate. And if someone, has a, religious reason, the employer is then faced with attacking credibility or pursuing an undue hardship analysis. And so culturally, employers have to be mindful of that and think through it and make sure they have a reasonable approach and that they're communicating with their employees so they understand exactly what's happening. And indeed, I think OSHA recognized that because there are some key notification requirements as well beyond simply the policy stuff that employers are obligated to follow, right? So there's, you have to educate your team about the standard, the ETS. You have to educate the team about COVID-19 vaccinations with an information sheet that's provided in the ETS. And you have to provide some other information that is contained in the standard as well that I can't recall at this exact moment. But, there very clearly are some other communication issues that have to be addressed here. But certainly this, accommodation undue hardship issue is not going away anytime soon, and I expect it to develop more fully as well over time as we see how things pan out.
For sure, yeah. So before I go to you, Dr. Michaels, talk about some of these enforcement strategies, I wanted to pick up Dr. Cherry and just kind of ask the question of, we saw that in this mandate that there's a reference to those that are unvaccinated, that they have to continue the masking process within the workplace. Any thoughts on that, and why maybe that was just included for the unvaccinated?
So there's been a lot of studies coming out in the last couple of months that look at viral loads in COVID positive or symptomatic people. And one thing that we've started to see is there are breakthrough infections in the vaccinated. However, they seem to clear the viral load much quicker than the unvaccinated. And so I think the masking towards the unvaccinated is addressing that difference of transmissibility and viral clearance. And so, that's what comes to mind when I look at that policy decision.
Gotcha. Okay. Well, moving on then to the one that I think that everybody is the most nervous about, which is this enforcement piece. And so, Dr. Michaels, I'll come to you and get your thoughts here. How is it that OSHA is going to be able to enforce this?
It's an interesting question. The rule will be primarily self-enforcing. When I speak to employers, most of the time they don't ask how will OSHA enforce the rule, they ask how do we best comply. I think employers are not resisting, they're adapting. This is because most employers, they want to do the right thing, they want to keep their workers safe, they want guidance for how to follow the rules, they don't want things to be too vague, and they also want a level playing field so they're not disadvantaged when they do the right thing, because that's going to cost some money. So I think what OSHA is going to do primarily is to respond to worker complaints. And there'll be lots of them, and they won't be able to inspect on all of them. But much of the response is going to be done by phone, that you would get a phone call from OSHA saying, we've had a complaint. They won't tell you who the person is. If the complaint is made, you would be asked to email or perhaps fax records to OSHA, and you'd have to do that pretty quickly, according to the rule. The agency is going to send out some inspectors for sort of spot inspections who will then issue citations and fines when necessary. The maximum fine for a serious violation is about $13,500, $600. I don't think OSHA is going to do that in most cases, though in unusual circumstances they could do that, or even 10 times as high, which OSHA has used that sort of penalty in the past when you had situations like an employer who ran a tax accounting office that refused to let their employees wear masks or let the customers wear masks, and someone got sick, and that was really a pretty egregious problem. But they will issue some big fines, and they'll issue press releases, because the objective of an OSHA fine, because there aren't that many inspections and the fines aren't so great, but by putting out a fine, it sends a message to other employers who are not in compliance that they should get into compliance in order to protect their employees. So the publicity is really to encourage compliance. So that's what we'll see, I think. I think mostly it'll be done by phone call. There'll be some inspections, and then some inspections will lead to citations and fines.
Gotcha. Yeah. So one of the other things that we've talked a lot about is this concept of the whistleblower and what type of a impact that could have in enforcement of some of these issues. If you have employers that aren't compliant and you have an internal person that is then reporting you to the organization, what type of notification would you get? Would you receive a phone call, or could they do unannounced inspections, or how would that work?
I think you won't get that many unannounced inspections. You'll get a few. And also, I think what will happen is when OSHA inspectors are doing other inspections, whether it's for machine guarding or it's a construction site or whatever it is, they will say, let me see your roster, let me see your records for this program. And if things don't look right, they'll ask for more details. In the phone call you get, if a worker contacts OSHA, you may be reminded that it's against the OSHA rules to retaliate against anybody who raises, or any worker who raises a concern with OSHA. And they will be very firm about that. So even if you have suspicions that someone may have called them, so what? Do not do anything to retaliate against that worker, because you could certainly get into much deeper hot water.
For sure, yeah. So whenever I think the last piece that we were going to talk about before we jump into many of the questions that are here was about the best practices. And I've heard, actually all three of you have had great insight and suggestions. Chuck, one of the things that I've always heard you speak about is the importance of being transparent and communicating with your employees about what's going on and how that's going to impact them. Do you feel like that this is going to be a huge move by employers to be able to keep that same stance and make for sure that they're involved in the process so that you don't have the complaints on the back end?
I mean, I think it remains to be seen how employers ultimately react, right? I certainly think that for employers that have larger employee populations where kind of the risk of multiple burdens, meaning lots of folks potentially calling in as a whistleblower, you want to be mindful of that. But ultimately, my perspective as being kind of an HR leader as well as a legal leader is, you want to make sure that the culture that is established or the culture that you want to build at that organization is protected and maintained. And so, while we are subjected to government regulation, it doesn't mean that we're going to take everything that we built in terms of our approach to employee communication, transparency, buy-in and all that stuff and throw it out the window, right? I mean, you still want to run through your process based on your organization's cultural identity to have that discussion, to talk about what's happening and why it's important and how we're going to handle it. I think the practical considerations that a lot of businesses are facing are, what impact is this going to have on an already difficult labor market? We don't know. I mean, there's been some anecdotal evidence. We hear about nurses, for example, leaving in droves when the healthcare standard came out. Droves is probably the wrong term, but certainly leaving. We don't know what the ultimate impact is going to be as more employers consider a more aggressive stance in requiring vaccination. So, certainly the culture should be the guiding light. Now, not all organizations have the same focus. They're still building culture. Maybe they don't have an immediate kind of thought around what their culture is or should be. Perhaps it's a culture by default as opposed to by design. And so in those circumstances, we're going to have to see how things ferret out, and you're going to be more reactive than proactive, I think. But, the great unknown at this point really is the way in which employees will perceive employers' behavior around compliance, ultimately. And they're going to make their own assumptions and create their own messaging in the absence of clear, open, and honest communication. So I think employers everywhere owe it to themselves to, at the very least, whether you have a culture that's like this or not, come up with an effective, truthful, open, and honest way to talk about what you're doing, why you're doing it, and how it's going to impact the business.
Absolutely. And Dr. Michaels, I was watching an interview that you did the other day with C-SPAN, and they were talking, I think you were asked the question about, what do we do as employers if our employees, threaten to leave if they leave their job if we make this a mandate. Share with our audience here what your thoughts were on that, about what that actual impact would be and what those numbers have kind of shaped out to at this point.
Well, this is a little bit of a moving target, but it certainly appears that many of the companies that have decided to have absolute vaccine mandates have actually done surprisingly well. The headlines go to the 8 workers in a hospital leave, and therefore obstetrics has to shut down. But for the most part, it's actually pretty small numbers. What you hear is there are a lot of workers who've been hesitant. They're not viscerally opposed to getting vaccinated, but for whatever reason, they sort of waited. And now, when their employer says you must get vaccinated, they get vaccinated. And so United Airlines, for example, which lost 600 employees, a little less than that, they've got 67,000 employees, so that's less than 1%. That's sort of it's a minor turnover issue in the big picture. The other thing is it's become increasingly difficult to find places to work that don't require vaccinations. And the federal contractor regulation says that if you're covered by that, the contractor can't hire people after December 8th who are not fully vaccinated. So I think there'll be fewer choices out there. I think this will change the culture of the country, saying that for many people, now's the time we've got to get vaccinated. And, it's going to make a difference. It's, we've sort of gotten used to this new normal of COVID, but, we had 1,700 people who died yesterday of COVID. This virus is not disappearing. And hopefully all of these new requirements will make a difference.
Definitely, yeah. And Dr. Cherry, just to finish up with you as well, You've always spoken about total worker health and the importance that the employees that that employers that they make that a priority, that they're paying attention to what's going on. As an individual employee can infect the workforce, they can, cause injuries, they can have accidents, etc. Do you feel like this is a step in that direction towards taking a little bit more responsibility and taking care of your employees at the same time?
I do, and I think this standard is actually going to reinforce and bolster that. Ever since COVID started, we've been recommending kind of a zero tolerance of infection in the workplace. So aside from COVID, there's always been flu, strep, RSV, other things where a lot of people came into work kind of as a badge of honor. But now we're seeing more than ever, it's very important to not allow any infectious disease into a workplace. And I think your comments, Dr. Michaels, I saw you talk last week about how you felt the primary mechanism would be whistleblowers. And so aside from having that transparent education to all employees about what you're doing, I think not allowing anyone sick into the workplace, whether it's COVID, flu, strep, RSV, is going to be huge, because if someone is concerned about their employer doing the right thing, if their coworkers are coughing, sneezing, feverish, they're going to be very quick to pick up the phone and call OSHA. And so I know daily health attestations weren't specifically a requirement per se in the ETS, unless I really just had a chance to scan it this morning, but it is spoken to a degree. But I think it's going to be a best practice, because it's one of the first primary preventive strategies to prevent any illness in the workplace at all, at least from a symptomatic perspective. And so, the other component I was thinking about is really having very timely response and case management to someone who tests positive. Someone may be asymptomatic but test positive and not really feel like they're a risk. So having a professional be able to direct them into the right resource. They need to socially isolate immediately. They need to get in touch with their primary care provider for warning signs of severe disease. And so employers now are, since they're somewhat associated with this weekly testing for the unvaccinated, they're going to need to either develop that skill set or partner with someone that can manage this new source of information that they're not used to dealing with. And lastly, I'll finish on what Chuck speaks to, is the data cycle management, where employers now are going to be needing to store and appropriately seclude that private information to the appropriate personnel. And so that's a whole nother skill set potentially for sectors outside of healthcare necessarily. So, but I do think this is a great bolstering of total worker health, which has kind of been at least around for 10 or 20 years, but hasn't really had the nidus to kick off. So I think this is going to bolster that in many ways.
Absolutely, I agree completely. Before we hop over to some of the town hall questions that we've gotten, I did want to ask Dr. Michaels, will you confirm again for what those dates were that were provided in the ETS for both the compliance program with your vaccinations, and then also those that would need to start a testing program, what the deadlines were there?
Well, it's 30 days. The overall program has to be in effect 30 days from tomorrow. I think that's more or less December 3rd or December 4th. And that means you've got to have your program. You've got to get information out to people. If they're unvaccinated people, they have to be wearing masks. You have to be able to call OSHA if you hear about hospitalizations or deaths. And you've got to have a program, as you've just heard, to isolate workers who are found to be positive, test positive. 30 days after that, approximately I think January 4th, will be when you have to have a program in place to start receiving the tests of unvaccinated workers. So you have to have that set up, and obviously you'll have a lot of options on how you set that up. But starting January 4th, if a worker is not vaccinated, unless you have a recent negative test, you can't let them in the workplace. Now, there are exceptions. They can work from home. If they're always working outside, if they never enter a vehicle or a building, they don't need to be tested. But those are the people who are covered by this.
Thank you. All right, so let's hop into some of these questions that were here. Let's see. We've got the first one that came to us this week from Mike, and Mike was asking, we have a production facility in Alabama, and the governor has filed suit against the federal government regarding the mandate. Would our management team still need to comply with the mandate? Who would like to take that one?
I mean, I think so. Just generally speaking, the fact that there's a legal dispute doesn't mean that you don't have to comply with the federal law. Unless and until there's some kind of an injunction or other court order, and even then it may be limited in jurisdiction, right? So it's going back to kind of risk appetite and risk tolerance of an organization. I think there are a lot of people asking the question, do we have to do this if we think there's going to be a fight about it? Again, you got to ask yourself more questions than just that, because your employees, whether you like it or not, are judging you based on everything you do or do not do. So, while you may want to kind of sit back and see how this ferrets out in the court system, it doesn't necessarily mean your employees all have the same point of view. I mean, even understanding that there's going to be an impact to the bottom line, relative to an enhanced compliance obligation, you got to be thinking about this more strategically than simply, is this going to ultimately be enforceable or not, right? And I think, at the end of the day, as Dr. Michaels has pointed out a number of times, right, OSHA is about making sure workplaces are safe and secure and free from unreasonable risk. And so it still doesn't free you from your general duty under OSHA to make sure that your work site is safe. So, it's not going to stop somebody like what happened with kind of the first lawsuit with Walmart, right, where an individual died because they were exposed at work. That's not going to, you're not going to get protection from those kinds of lawsuits because you're going to sit back and say, we're not doing anything to see if this is enforceable. So, there's no clear answer here, but that's my kind of perspective on
it. If I can add, the standard very clearly says that this preempts any state or local law or regulation. And so while that will be fought out in court, anybody who reads that is going to say, what, this applies. Certainly OSHA will sit, if OSHA gets a call, they will send in inspectors unless a court stays this whole standard. So I would very much agree. You've got to just move forward with the standard.
Yeah, for sure. Let's see. I believe Debbie was next. Debbie said, if several companies are owned by a private equity firm, each having their own EIN, would the 100 employee criteria apply to each of the individual companies?
Look, I think that I highly encourage you to talk to your own lawyers about this, right? But ultimately, I think the standard has switched. There was a time a number of years ago where PE groups were a little bit concerned that joint employer doctrine was going to extend. It's not just about EINs though, right? It's not just about, kind of those form issues of form, right? You have to address control, leadership structure. If it's separate entities with separate EINs and it's the same CEO, the same management team, the same payroll system, I don't know. I encourage you to talk to your own lawyers about that to get a readout on the potential for joint employer liability. But again, going back to what I said earlier, it's not going to relieve you from any and all obligation here, even if you're not 100 employees, right? Title VII, for example, which is the religious accommodation, where the religious accommodation issue comes from, applies to employers with more than 15 employees. So you're still going to have to run processes to manage, situations here. And if you've got no centralized leadership, you're requiring vaccinations at different localities. There's all kinds of issues that pop up. But ultimately, this is a joint employer issue, and the facts of each situation will drive the determination as to whether or not you hit the 100 employee threshold or not, I think. But again, I'm not your lawyer, Debbie, so please do talk to your own attorneys about that.
Yeah. All right, let's see. I think Carson was next. Carson was asking, I am hearing different answers about testing. Do we have to provide employees with PTO for vaccination and testing?
Could you repeat that question? Do we have to provide?
Yeah. So Carson was saying that he was hearing different answers about whether you needed to provide PTO for your employees for both vaccinations and also for testing if they elect to not get vaccinated.
You mean PPE, perhaps? That well,
paid time off.
Paid time off.
Oh, time off.
Uh-huh.
No, that's only for vaccination. It's a little complicated. You have to provide 4 hours for vaccination if people have not been vaccinated. If people need time to recover and if the vaccination occurs over the weekend and time they're not normally working, you don't have to provide that time. If people need time to recover from the side effects of a vaccination, you can have them use their sick time if they have sick time available. If you don't provide sick time, or if they have no sick time available, you have to give them that time to make sure that they can recover.
Gotcha.
But you don't have to pay for it if they have sick time.
You don't have to pay for it. Okay, gotcha. And Chuck, I would assume that you would advise then organizations to make for sure that their policies were updated with that information as well.
Yeah. Yeah, policies are critically important in this kind of stuff, right? Because that is the document that drives uniformity and consistency of approach. And a lack of uniformity, a lack of consistency is where risk lives. Absolutely.
Yeah. Okay, let's see. We've got one from Joanne. I think we kind of covered this a little bit earlier, but she was asking, recognizing that COVID can be spread in vaccinated and unvaccinated populations, why does the ETS require masking only in the unvaccinated? Dr. Cherry, was there anything else you wanted to add to that?
It's a reasonable question, but certainly people who are unvaccinated are much more likely to be spreading it to others. And that's the idea here. They're also much more at risk. You could make the case that in areas where there's high levels of community transmission and there are lots of people in a poorly ventilated area, everybody should be masked. But I think OSHA was limiting how far they were willing to go. And I think also they were really trying to focus on just encouraging vaccination and discouraging unvaccination. So people who are not vaccinated have more burdens. Not only do workers have to be masked, but there is no requirement that the employers provide the mask, which is unusual. All previous OSHA regulations require the employer to provide any material that's needed to meet a standard.
Mm-hmm. Yeah, maybe what I'll just add is, just like with many other OSHA medical surveillance standards, companies can elect to go above and beyond what's in the standard. Sometimes, there may be new science that comes out after the standard is passed, or other guidelines from the certified industrial hygienist or other agencies. And so many companies go above and beyond. And I think this is a great case here where it depends on risk tolerance, as Chuck talks about, for an organization. But, in general, I would say when we think about workplace safety, the workplace should almost be safer than the general public, so to speak. And so, and that may be just our philosophical approach, but many times when we do our evaluations of our effectiveness of our programs for our clients, we show an exponential level of lower risk of infection in the communities that they operate. And so I think, again, the ETS is a nice requirement to work off of, but there can still be best practice over and above what's in that standard.
Absolutely. Yeah. Let's take some questions that actually came from the audience as well today. Let's see. The first one we will take. Clinton asked, there is no research to back up the claim. Was saying if we have a decrease in vaccinations. Clinton, we may follow up with you individually on that one. Let's see, Viking Group. What data is Dr. Michaels using to say that unvaccinated employees are much more likely to pass on COVID?
Well,
Dr. Brown, would you like to
first
comment?
of all, look, unvaccinated workers are much more likely to get COVID. So that alone makes them much more likely to pass it on. In addition, there's some evidence that people who are vaccinated don't have as much of a viral load for as long a period of time. So you could certainly, people who are vaccinated can absolutely spread the disease, and they can be infected by others who are vaccinated. But the unvaccinated are just far more likely to both spread the virus and to be the recipient of the virus and become infected.
Okay. Let's see. Melissa was asking, in a work location, are we to rely on the honor system for accountability dates, especially those that everyone we cannot share with everyone who is vaccinated and who's not. So I think what she's saying is that, we really can't point people out as to who's vaccinated and who's not vaccinated. So does it then revert back to the honor system on how it is that of who it is that would need to be wearing masks and who would not?
No, I mean, I think that OSHA makes it very clear in the ETS that one of the obligations of the employer, and this relates back to kind of the data cycle management piece, is they have to create a record of who is vaccinated and who is not, right? And so you have to run through that process, and then there are very specific ways in which someone can provide that proof. And then there is a kind of final option that if the proof is lost, right, the acceptable forms of proof are lost, then an attestation can be provided. However, one of the elements of notification that an employer is obligated to provide is also a reminder that statements made in fulfillment of the standard that are fraudulent can subject you to criminal charges, right? So there is some honor system component here, but the consequences for misrepresenting could result in criminal charges here. And so I think that this is, again, an example of OSHA doing what they can, given the circumstances, to provide a structure where it's, reasonably clear what's required to provide proof. And then in the absence of proof, we'll allow people to attest. However, if they're misrepresenting, then, we're also educating them that they're subject to claims, criminal charges. Okay.
Good information. And Dr. Michaels, I know that you have to drop off here in a few minutes to you have an interview on CNN as well, but you're welcome to stay with us just as long as you possibly can. But we understand you need to follow off. Yeah. All right. The next one came from Brian, and Brian was asking, is there not any documentation that is going to be required for the daily attestation of health? So the daily health checks. Either if you want to take that. And I know that we typically
didn't see any requirement when I reviewed the ETS for documenting the daily health attestation component of it. I would just probably reinforce it. It may be good to have that as part of your policy requirement and even a functional component of it, because over time complacency can and will kind of take over. And so you do want to have some type of system that would really track and, functionally disposition those that are reporting illness, whether it's they go into the sick leave bank or into some type of absence management. So, but I don't think it's a hard requirement of the ETS.
Okay.
Right. On the non-healthcare standard, it's not a requirement. I believe it is a requirement on the healthcare standard. But the one thing I want to add to what Scott just said is, we're living in an interesting time, right? And I think that as businesses' eyes are opened to the impact of illness in the workplace, at what point are we all going to take a step back and look at this and say, listen, COVID is one example of the bad things that can happen when people come to work sick. And as Scott mentioned earlier, is it time for us to begin to address, this kind of scourge of illness in the workplace more generally? So it's not just now, clearly we have regulatory requirements related to COVID, but what is the impact of lost time from work because you're sick prior to this anyway, right? As Holly's heard me say many, many times, it's in the hundreds of billions of dollars of lost time from work based on illness, historically. So, the daily health attestation is another way that businesses can begin to think about a proactive approach to not just address kind of COVID outbreaks in the workplace, but also potentially address outbreaks of other disease that are albeit less severe, but nonetheless have an impact, right? I think that's what we're talking about.
Absolutely. Let's see, Diana had a really good question too. What responsibility does the employer have for on-site temporary labor workers, and would they need to be included on the vaccination list and testing record keeping for the site employer? So I think they're asking, what about the employees that aren't necessarily full-time, they're just contracted there for a short time period? Do they fall under the same regulations as what others would? Dr. Michaels, you want to take that one?
Yeah, it's my understanding if they get you to above 100 employees and you have some responsibility for them, they are covered. My recommendation is to tell the staffing agency that you only will accept vaccinated workers. You can do that, and that certainly solves a lot of your problems. But they certainly are covered if they're in your work site. If for some reason they're not vaccinated, then they have to be tested and they have to be masked.
Right. Okay. Let's see. Stephen asked, if an employee goes to get vaccinated on one of their regularly scheduled days off, so that would be like a weekend, do employers still have to pay the 4 hours? Thoughts on that?
My understanding is that they don't, but Chuck, maybe.
Okay. Chuck, do you have anything to add there?
Well, I'm sorry, Holly. One more time, I missed it.
No worries. If an employee goes to get vaccinated and it's on one of their regular days off, so that would be like a weekend in particular, would the employer still have to pay for the 4 hours?
Oh man, I mean, that's one of those questions that is going to have to ferret itself out. I mean, if they're fulfilling a requirement for work, then the answer is probably yes, right? They're going to have to pay for that time, even if it's their day off.
No, I think OSHA actually, this is one of the challenges here. This is a huge document that just came out, so we'll be all reading it more carefully. But I actually think that they said if it's on the weekend, they don't have to. So listen, I'm going to jump off at this point. Thank you all for your interest in this. I want to thank the folks from Axiom for putting this together.
Absolutely.
This is the beginning of a whole new process. We'll see how it goes. If you want to see me on CNN in 10 minutes, that's where I'm headed. So take care, everyone.
All right. Thank you, Dr. Michaels. Yeah. For the rest of you, we're not done here. Yeah, we still have a few minutes. So we'll continue with the Q&A. All right. Well, Freddie had asked, we have a production facility in California with a federally approved state plan. Do we have to follow this ETS, or do we wait for the Cal OSHA to implement their own program? That's a really good one. We've had a lot of questions about Cal OSHA. Chuck or Dr. Cherry, which one of you wants to take that one?
Yeah, my understanding, the way state and federal OSHA interact is the state OSHAs can exist and function within the state, but their standards and guidance have to be at a minimum what federal OSHA is speaking on a certain subject. So I would say they need to at least start following the federal component. That's what I would advise a client, absent kind of legal or HR input there. But that's kind of my gut feel from that perspective.
Okay.
Yeah, usually the way the state plans work is the state plans, get approval from OSHA to administer their own plans, and as part of administering their own plans, they have to agree to have a standard at least as strong as the federal standard, right? So theoretically, if OSHA announces a standard, as it has here, that preempts kind of state law, the state plan likely will prepare anything or any changes, modifications that need to be made to meet the minimum required, right? We'll see.
Gotcha. Okay. Let's see the next one. Ooh, this is another contractor one. Sean was asking, will contractors for private companies smaller than 100 employees that do contract work for the larger companies, will they have to submit their testing data to the larger corporations?
I mean, the standard's silent as to those kinds of issues, right? I think that's going to be more based on negotiations and expectations. And if the larger employer is a federal contractor, then you bet your butt you will.
Oh, Chuck, I love it. Okay, let's see. Yeah, next one. What's considered proof of vaccination? Does it actually have to be a copy of the card, or is it a self-certification, or would self-certification be enough?
Yeah, I mean, it's very specifically listed in the standard. Let me just turn to the page and I can read them off for those of you that want to know what proof is. But essentially it's, oh my goodness. It is a copy of the vaccination card, it's medical records, it's public health records, and it's quote unquote any other official documentation. And then if you've lost any of those categories of information and can't obtain it, then you go through that kind of self-attestation approach where you're signing on, you submit a piece of paper that says, I affirm that I'm fully vaccinated, and you declare under penalty of perjury that it's accurate, right?
Okay.
Again, right, we're going back to a little bit of honor system in those circumstances, but right, don't forget the standard also requires the employer to educate the employees and let them know that if they're misrepresenting, they're subject to criminal charges.
All right. Let's see. James says our organization has over 50 separate units. Total, we have over 3,500 employees. Based on the 100 employee rule, that would be for each separate unit or as a total. And he says each unit is part of the organization but operates separately. I think this may fall into the same response as you had a while ago that we spoke about earlier, Chuck.
Yeah, and look, guys, I can't provide legal advice to your organization about those kinds of issues, and you know, that kind of a question just creates more questions in my mind to ask you to try to get to an answer. And so what that tells me is you should talk to your own lawyers about it to try to get an understanding of where that joint employer doctrine may create a challenge for you. Yeah.
Okay, let's see. Clinton was asking, let's see. There's no evidence. Let's see. Actually, let's go to Doug. Doug says, what is the emergency OSHA? What is it that the emergency OSHA is actually protecting us from?
Unreasonable risk of illness and injury resulting therefrom.
Mm-hmm. So
right? I mean,
maybe outbreaks as well. Yeah, outbreaks, all of those things that come along with it.
I mean, really what it comes down to is, you know, there's a big push to relieve pressure on the health system. And so what we're hearing from all of our public health officials, CDC, World Health Organization, is vaccination is a really good way to mitigate the impact on the health system, right, by creating kind of all these hospitalizations, which is a national emergency. If we have hospitals that are full of people that are sick, everyone else that's, you know, got other issues is not able to get health care. So that's kind of a collateral issue. But fundamentally, on the OSHA emergency standard, you know, employers have an obligation to make sure employees are free from unreasonable risk of illness or injury. And this standard is designed to create a framework through which employers can make sure that they're mitigating unreasonable risk of illness.
Okay. All right, one last one here that we have, and actually it's pretty good. So Russ says, the FAQs say that the ETS is projected to be in effect for 6 months. If no extensions are made, does the standard nullify or does it continue until formally discontinued?
So typically the way the ETS approach works, if it's not struck down, it'll run through its 6-month course, and they're designed to become permanent with modifications. So whether that holds true for this kind of a standard that's very particular to a specific illness remains to be seen, but I can tell you that I would think that specific administrative agency action would have to take place to prevent the 6-month ETS from becoming a more permanent ETS down the road. You know, but you guys can check me on that. Talk to your own, you know, attorneys about it to make sure that I'm not using that, but I believe that's how it works, or how it's intended to work.
Okay. Well, I think we're kind of made it to the end here. What I will say is that there's a ton of questions that are here. And so I will work with our team. We'll look at putting together maybe a follow-up this next week so that we can get to these specifically and answer, provide you some additional information. And obviously things will be changing daily as we're all working towards getting everyone compliant here. But I would just like to extend the opportunity to both Chuck and Scott, if either one of you had any closing remarks that you wanted to, parting gifts you wanted to give us before we wrap up for the day.
Maybe I'll just close with, I do know to some degree, maybe based on that last question, there is some contention around this, and it's obviously a mix of medical and political compromise. Even on the medical side, things aren't fully suited out. And so I use this almost akin to kind of, if you look at TV shows or movies, maybe back in the 50s and 60s, where you see your coworkers kind of chain smoking next to you. And so I think this is also trying to remove that kind of risk. With obviously there's personal choice involved too, but these are very challenging times. And I think this 6-month period will kind of weather test the ETS, and perhaps will give us insights into if OSHA decides to refine it or make it more functional based on new studies and on feedback from how employers are tolerating these practices. So, I mean, this is a huge cultural shift.
Absolutely. How about you, Chuck?
I don't have anything to close with. I think, there's a lot to think about, a lot to digest. I'm happy that the standard is finally out so we can stop guessing. Now comes the hard part, preparing and understanding what this means for all of us. So, we're going to continue to do what we do and push out, LinkedIn posts and provide webinars to get some information out there. But thanks to everybody for participating today. And it's a brave new world.
Absolutely. Appreciate you guys participating. That really is our commitment. It's what drives us every day, is to be able to make for sure that we keep you ahead of the game and that you have an honest conversation about this every day. So we will continue to put out some additional information. We'll do a follow-up maybe this next week. I would say, though, that if you want additional information about one of those demos for the vaccine or the test vault, simply press that button there. There's also the resources there for the guide that's available, in addition to some of the other OCC programs, OSHA COVID compliance. So if there's anything that you need, please don't hesitate to contact us, and we look forward to seeing you next time. Thank you for joining. Bye-bye.